that moment of choice, that moment of choosing. It's not flashy. This this choice is usually one we make in the dark, crying, alone. It's not, I can't do this anymore. Sometimes it starts there, but you can. It's a moment of I won't. I'm not going to do this like this anymore. You don't need to know what this looks like. You don't care what it's going to cost you. You just know that you're not living like that anymore. This vision that you have, this imagination that you have, this way that you know that it could be, you can imagine it working, but you're not seeing it done. You've tried saying it a certain way, and you've tried overachieving to show them, and you've tried showing them how great it can be. And if you just say it maybe the right way, then they'll understand. But they don't want to see. Those that you're trying to tell, that carefully constructed email to the CEO, the well placed ideas in the department meeting, they don't want to see. Those of you that I'm talking about at this point and that remember this point are in this grief and internal conflict place. This is where I see so many clients and where we see as a whole so many brilliant, caring, and compassionate providers and physicians landing on this idea of leaving healthcare. But before you throw away the years of hard work that it took you to get where you are, let's talk. This was me. I left in my integrity. I'm not doing it this way anymore. This isn't okay. I left. It kept getting harder and harder and seeming even harder to listen to patients and to respect them and treat them as individuals. It seemed like no matter how hard I tried in that system or in this job or in that clinic or in this arena, they simply had very different values than I did. No matter what I did, no matter how hard I tried to show them, they were looking at something completely else through a completely different set of lenses. I couldn't change them. So I walked away. I believed that that was my only choice, that I wasn't going to be a part of that world anymore. And so I left. Now, in the years that followed, I learned and I failed and I learned some more and I failed some more and I got back up again. But taking that time away and learning those new things, I was able to look back at healthcare and see things in new ways. One of the things I saw was that while healthcare uses futuristic technologies every day, and there's more and more and more coming, the management styles and beliefs fueling the entire system are 100 years old and so far behind other industries and other ideas. There's so much room for new ways to do things. There is a new way, a way where you can honor you, where you can honor your values and cherish and respect you, your staff, your patients. Now, I came back directly for a time after I saw this. I worked at a local community care clinic, but I realized in talking with people and looking back over healthcare and connecting with my colleagues that there are so many brilliant providers out there and doctors out there and physicians and whatever word you need to use for you that are feeling the same way that I did. You are the ones that care. And I realized that the impact that I can have in healthcare can be multiplied by sharing what I learned and helping you be the doctors that you want to be. That the impact that we would have collectively, yes, individually as physicians and doctors and providers, we impact each of the patients that we see and talk to every day. And not just them, it expands out to everyone that they interact with too. It's huge. The impact that we have in the healthcare field is huge. But I realized that the impact that I can have is even greater, helping you be the provider that you want to be. So while I love patient care, and I remembered that again doing some volunteer work just recently, I love even more seeing you succeed in the ways that you love. Not just the ways that I love, not just the values, the things that I think matter, but I love seeing you succeed in ways that you think matter. That moment that you realize, wait, this idea that I had, I can do that. These are the moments I live for. That moment where I see you sit up a little straighter and hold your head up a little higher, remembering that you matter. You are not some tiny cog in a huge system. That you are a doctor, a physician, a provider, and that you matter. There's a moment when I'm working with people and they exhale when they realize that it's possible. That's not right. That it's required to serve from your overflow, not your depletion. And they hear that and they get that deeply for the first time. And there is a exhale and even emotion sometimes that comes with that. There's a phone call that I get where people say, I did it. My dream came true. Now, I don't share these all the time, and I don't share a bunch of testimonials, and I don't do that because their dream is not yours. You are an individual with your own goals and your own way that you want it to look. So there is zero reason to be comparing you to someone else. I don't do that. So to get more of those moments, to get more of the moments that you love, that I love, back up. Stop pushing so hard. Stop being so damned resilient. Look around you. Bring awareness for what's true. Not what you want it to be, not what you know that it could be, not what you wish that it would be. Take a look at what's actually going on around you and grieve that it's not what you know that it could be. Separate that relationship, that what you wish it would be from what it actually is. It's a powerful moment being able to separate those two things. Then this first step is where we started the conversation today. It's that quiet choice that I'm not doing this like this anymore. That is not the place for me. There's a willingness to go in the unknown that happens in that moment. But the thing is that you do know where you're headed. You do know what you want it to feel like, what you want it to look like. It's all these things that you've been imagining. It's all of these, yeah, but if they just, yeah, but they could so easily, yeah, but why don't they? It's all those things you've been trying to help them see. No, you don't know the path yet. That's true. That will appear. But acknowledge that you are trying to fit your beautiful dream, this imagination for what could be, into something that was already created from their dreams and their fears. That's somebody else's. Your vision doesn't belong there. If they don't hear you, if they don't see you, if they can't grasp your vision, if they don't want to see it, your vision doesn't belong there. You are meant to create something new. So let's start clarifying that dream, those values. Let's start writing down all of those, yeah, but if they would just. The what matters to you, your truth, what your full expression is, what's authentic to you. What do you want it to feel like? You know what this is, but you're going to downplay yourself. Write these things that you've been thinking and all these, yeah, but if they would just, and all of these, if I could just help them see, and all of these, help me help use, and all of these overachieving so I can show them. Write those down. You know where you're headed. You know what you're building. You know what you're creating. Commit to your imagination. Commit to that decision. It's a choice. It's a choosing. It's not a, yeah, that sounds great someday in some world. It's a, yes, I will create this. Commit to that. And as you do, take a deep breath and exhale everything that's not that. And another one. And another one. Then on this next one is this commitment piece. Quietly to yourself on this next exhale, say yes. Commit to you with a yes. So inhale, exhale, yes. Let it get louder and louder and louder as you have this space, as you commit to you. Let's start getting you confident in you, in your wisdom, in your brilliance, inside and out. Start building that dream and have fun doing it. You're not afraid of work. Just not the redundant, arbitrary, busy work that goes against your values and depletes you. You're committing to your values and your dreams, the work that gets you toward that. It feels different. You are building your dream practice. You are making your dream practice inevitable and committing to loving your work again. Let's do this. I'll see you soon.